Hello, I'm Jared Weiss, medical oncologist and vice president of Cancer Grace, and it's my pleasure to be here tonight with Josh Baumel, Dr. Josh Baumel of Hospital of University of Pennsylvania, and Dr. Sid Sheth from the University of North Carolina. We're here tonight to discuss advances in cancer treatment of head and neck cancer from the ASCO 2017 meeting. Welcome, gentlemen.
Thank you very much.
So we've shown that there are ways to better identify who's going to benefit from immunotherapy. Obviously, a lot more work done before people should be perhaps excluded on these.
Absolutely.
To be sure we know how they work.
Absolutely.
The other avenue you mentioned was adding other drugs?
Yeah, and this is something that we're hearing a lot about in the community. Adding different immunotherapies together, adding immunotherapy with chemotherapy, adding all of these drugs together. And it's appealing, because we want to amplify the response, and immunotherapy is very exciting, but we have to do it cautiously because some of these drugs can have significant side effects. One of the studies that was presented at ASCO this year, though, evaluated a combination of pembrolizumab, PD-1 inhibitor we've spoken about, with epacadostat.
I'm impressed you can say that.
Well, it's, you say it enough, it rolls off the tongue. So epacadostat is a drug that inhibits something called IDO. And IDO is involved in the immune system at a different side than PD-1. So it's trying to approach the same problem from different angles. And what we found in this study was that the combination of pembrolizumab with this IDO inhibitor epacadostat was associated with a much better response rate than we see with PD-1 alone. So PD-1 alone in head and neck cancer has a response rate 15 to 20%. And we see this across many tumors, 15 to 20%. The response rate we saw with the combination was 34%. That's better. And actually, if you take those patients who had only had 1 to 2 prior lines of treatment, it was 39%. So this is a big deal.
And what is, just to remind people, what does response actually mean?
That's a great question. And so response means that the tumor gets about a third smaller. Okay.
So if it shrinks 29%, you're not a responder.
That's correct. So it actually probably underestimates the benefit that we see. So for instance, if we look at pembrolizumab, the response rate is 15 to 20%, but the clinical benefit rate, meaning the tumor either gets smaller or just doesn't get bigger, which we view as a win in metastatic cancer, that's closer to 40%, okay, or maybe even higher in some analyses. So this is a big move forward for these patients.
So it sounds like you're highlighting this drug and this mechanism as particularly promising things that will probably be available to patients in clinical trials and hopefully approved at some point if all those trials work out.
That's exactly right. And the other thing which is very appealing about this combination is that it's very well tolerated. Epacadostat is associated with very few side effects that are of note, and nothing terribly life-threatening was seen on these trials. And this has been evaluated, this combination has been evaluated in a broad spectrum of tumors, not limited to head and neck.